do that. Okay, so good morning and welcome. I'm Nicole Kirschhofer, Patient Experience Officer here at Maimonides. Today we are here to listen and learn about design thinking in healthcare, also known as human-centered design. This is a problem-solving approach that places people at the center of the process. This framework will enable us to design services and systems that addresses the user's needs and create an optimal experience and, most importantly, improve patient outcomes. I'm honored to introduce our special guest speaker, Marion Leary, who is the Director of Innovation at the University of Pennsylvania School of Nursing and is a thought leader in the field of innovation and design thinking in healthcare. Before I turn it over to Marion, I just kindly ask that you keep your mics muted and wait until the end of the presentation to ask questions. Thank you so much. Okay, Marion, go ahead. Take it away.
Cool. Thanks, Nicole. Thank you all for having me. I really appreciate it. I'm looking forward to speaking with you today about using design thinking to create health and healthcare innovations in healthcare. So as Nicole mentioned, I'm Marion Leary. I'm the Director of Innovation at Penn Nursing. I'm also on the Innovation Advisory Committee for the American Nurses Association and a founding member of SUNCL, the Society of Neuroscientists, Innovators, Entrepreneurs, and Leaders. So I get to hang out with a lot of cool nurse innovators and entrepreneurs all the time, and really their work is what benefits me and will add to this presentation. Just one disclosure, I have a grant from the Rita and Alex Hillman Foundation for one of the human-centered design and design thinking projects that I will talk about today. All right, so let's jump in and set the foundation. What is innovation? So at Penn Nursing, we define innovation as the application of something new or the creation of something different that delivers value. So we're not just talking about technologies or widgets. Those things can be innovations, though they're not always innovations, but we're really talking about the methodologies that we use to solve problems, the systems and processes we create, the way that we educate our students and our patients, and the way that we communicate with communities and each other. All of those things can be innovation. And innovation, like it says here, is an approach that's infused with creativity and risk-taking. And if I leave you with nothing else today, is that creativity and risk-taking in healthcare is okay if you use a rigorous methodological approach. And that's what we're going to talk about. So why health and healthcare innovation? So as you know, it can take anywhere from 10 to 12 to 15 years or more to get something from bench to bedside. I apologize, phone's ringing. And as we saw during COVID, we really can't wait that long. We need rapid creation of new ideas and new solutions in a much quicker time. And so innovation really allows us to create prototypes in weeks to months instead of years. Using an innovative methodology also allows us to work with patients and clinicians and understand their needs from a really fundamental foundational component. And so what I'm going to talk about next is the foundation of design thinking and how we really understand the contextual needs of the people we're designing for in a much deeper way. And then also, working in innovation, it's a team sport like healthcare. And so we need to work with all of our interdisciplinary colleagues, not just nurses or physicians, but really engineers, designers, community members, whoever the problem affects and whoever has lived experience to contribute to the creation of a solution is who we want to include on this team. And that's really the foundation for an innovation teamwork. So what is human-centered design and design thinking? So it's a human-centered approach that integrates the needs of the people. So if you see here, it is a 5-step process that starts with empathy, understanding the needs of the people you're solving a problem for, defining that problem, creating solutions, prototyping those solutions, and then testing them. And though it looks like a linear process, it is really iterative. You're constantly going back between each of these phases and learning more, iterating, pivoting, and adjusting based on the insights that you garner during each of these phases. And so, it's also a process that has a bias towards action. So human-centered design and design thinking is an active learning methodology where you are constantly working through these phases. It's not really about me sitting here and talking to you about it, but really going out and doing it, learning by doing. So this bias towards action when you're working through a design thinking process takes place in every phase of the design thinking process, through empathy, through define, ideate, prototype, and test. And it really is a divergence and a convergence throughout. And so this is better represented through the double diamond model, where you're not only designing the right thing, and that comes from the early phases of design thinking, but you're designing things right, which happens at the later end. And if you can see here at the beginning during that empathy phase, where it's your discovery phase, you're diverging, you're giving a wide view of what the problem is that you're trying to solve. And then when you're trying to define that problem, you converge and you narrow down and you think about what the problem is from the point of view of the people who you were discovering in that empathy phase. And then during the later half, when you're really starting to design the solutions, you diverge again. You come up with as many creative ideas as you can to solve the problem you just defined, and then you converge on the potential solution. And I'm going to go through each of these steps in much more detail, but just keep in mind that this really is a diverging and converging process throughout these 5 steps of design thinking. With that bias towards action, you're going to work through a variety of different activities so that you as the healthcare provider, you as the designer, really understand the problem in such a deeper way. And hopefully you are co-creating these solutions with the stakeholders that you are designing for. All right, and so this bias towards action, like I said, it goes through the entire design thinking process, and it starts with empathy. It starts with having a beginner's mindset where you are putting your biases aside, your assumptions aside, and really allowing your stakeholders to show you and tell you what they know that their problem is. And that's where you then go into the define phase, where you're creating a problem statement from the point of view of the people for whom the problem affects. So it's not what you think the problem is, it's what your stakeholders have now showed you and told you what the problem is. And that's where you define your problem and create that problem statement so that you're accurately able to then create solutions, and as many creative solutions as possible during that ideation phase. Next is the prototype phase, where you create potential solutions that can be interacted with by your end users. So during this phase, and again, I'm going to show you some examples of this, we create what's called a low fidelity prototype. So you can take your potential idea, give it to your stakeholders, and let them interact with it and give you feedback. This is where the iteration component comes into play. And then finally, you do that out in the environment where the problem occurs, again, with the people for whom the problem affects. This bias towards action happens throughout the entire process. This is where you get that active learning by doing, human-centered design approach. And that's why I think the innovation process and the nursing process go so nicely together. It's basically the same thing, we just call it something different. So, you see here the 5 design thinking phases: empathy, define, ideate, and prototype. Well, they match really nicely with the nursing process. We start off by assessing the patient, determining what the problem is, coming up with a plan on how we're going to address the problem, intervening with our solution, and then evaluating. It's the nursing process, it's the innovation process. As my colleague, Dr. Kathy Bowles, likes to say, it really all goes nicely together. And that's why innovation should be so natural for nurses. And that's why in the latest Future of Nursing 2020-2030 report, they now recommend competencies for nursing education around human-centered design and this innovation mindset so that we can set up our future nurses for these competencies to be able to use human-centered design and design thinking in practice. So the way that we're doing this at Penn Nursing is in a variety of ways. I teach a class called Innovation in Health, Foundations of Design Thinking, which really is a foundational class to teach not only nursing students, but it's open to all students across campus. Again, we need that interdisciplinary approach to be able to creatively come up with solutions. And so we teach this class that integrates nurses and other students so that they can learn the foundations of human-centered design and design thinking with a healthcare lens. And so in that class, I use this Design Thinking for Health platform, which is an open access platform that nurses can use to learn about design thinking. And we created this in partnership with the Rita and Alex Hillman Foundation. On that platform, we have original content that we created, lecture videos, case study documentary videos of nurses using design thinking in their practice, a variety of podcast episodes, and a lot more. It is an asynchronous platform that nurses, nursing schools, and healthcare systems can use to create courses or workshops to help their nurses learn about innovation and human-centered design, but also really work through problems that they're seeing in their practice using this methodology. So it's set up so that you can work through each of these different phases and includes the associated activities. I tell you this because, one, I'd love for you to use this as a resource in your practice, but also I'm going to go through a case study that previous students have used to create a solution in my class, and they use this Design Thinking for Health platform to do that. So I think, to be able to learn about human-centered design, you need to do human-centered design. But I also think when I'm talking about human-centered design, it's really helpful to see a case study of how others have used the different human-centered design activities to address a problem, so that you can really contextualize what this looks like. So this was a group project from some students in the spring of 2021 called Safety Gown. So I'm going to walk through each of the phases of design thinking and talk you through how they use these different design thinking activities to understand the problem that they were trying to solve for and come up with a solution. So phase one, empathy. This is our foundational phase. This is where you really gain a deeper understanding of the people for whom you're designing. So again, as healthcare providers, as designers, as researchers, we're not going out and telling people what we think their problem is. We're really allowing them to show us and tell us what they know their problem is so that we can create accurate solutions to the problem that they've identified. And all of that contextual inquiry, all of that learning comes from the empathy phase. This is really the most important part of the design thinking process, because if you do not understand the problem correctly or accurately, you will not create the right solution. And I think as providers, we see that a lot. Solutions being created that may not accurately address the problem. So in every phase of design thinking, there are a number of different established activities that you can use to really drive the process forward. So I'm going to highlight some of my favorite design thinking activities, some of the activities that I have our students do to help them work through this design thinking process. These are all established activities. I put sort of the logos of the organizations that create these activities on the bottom. And we use a lot of these on our Design Thinking for Health platform. So when you're in the empathy phase, the first thing you need to do is define your audience. So you have a broad topic. Again, remember the divergence and convergence. In this phase, you have a broad health or healthcare topic that you are hoping to solve for. Well, there are so many different types of people a problem can affect, and you can't create a solution for every type of person. And so you really have to start to figure out who your audience is. And the way to do that is by defining your specific audience, thinking about in this sort of circle activity here that you see on the right, like who is the main group of people your problem affects? Where does it go out from there? And you build out until you have a full understanding of the various different populations under a health or healthcare topic. Once you define your audience, then you go out and you interview and observe. Again, this is one of the most important parts of this process. You really need to do a lot of contextual inquiry to understand the problem. And so in this class, our students spend a couple weeks with whoever their population is, going out and interviewing and observing. So this group, the safety T group, wanted to look at the problem of sexual assault. And so they decided that their population was going to be women who were recently sexually assaulted. And so they went out and they interviewed women who were recently sexually assaulted. They interviewed nurses who work with women who were sexually assaulted, and started to interview and observe and understand what it was like for these women and what problems that they were voicing during the interviews and what students could observe during some of the observations that they did. So they used the interview and observation activities to, again, gain this deeper understanding so that they could come up with some insights to use in the later design thinking phases. One of the other activities we had them do after they collect all of these data from their hours of interviews and observations is called an empathy map. As you probably could imagine, you get a lot of, the more interviews and observations you get, the more insights you come up with, the harder it is to pull things out randomly. And so this empathy map really allows you to situate your user. So thinking about that, defining your audience activity, we now have a specific user we're trying to understand the problem for. And you start to pull out from all of your interview and observation data, what did my user say? What did they do? What did they feel? What did they think? So you can start to look for themes of issues or problems that this population keeps bringing up. And that is when we start to get into that convergence phase of pinpointing what our problem is to create an accurate problem statement. So this was the empathy map those students did with their sexual assault survivor, pulling out what they heard them say, what they saw them do, how they felt, and what they were thinking. Which brings us to the define phase, where we take all those insights and we put together what's called a problem statement. Again, from the point of view of the end user or that stakeholder of the sexual assault survivors for this specific group. During the empathy phase, though, during the define phase, we still want to take all of that data from the empathy phase and contextualize it. So one of the other activities we have them do is called a journey map. And this is where they lay out mostly from their observations, but from some of their interviews also, a point in time that is specifically looking at a certain problem. So this could be a 12-hour shift. This could be a 8-hour day. This could be 12 months in a year. It really depends on what your problem is and the time frame you're trying to solve for. For this group, they were really looking at the time immediately after someone was sexually assaulted. So they put together this animated or illustrated journey map that I'll sort of read off for you here. So this is Penny. Penny was just sexually assaulted and is feeling scared and overwhelmed. Penny goes to the Rape Crisis Center and is told that she's going to be seen soon, but she really does not want to be there, is feeling, very uncomfortable. She goes into the room to be evaluated by the sexual assault nurse examiner, who asks her to, describe what happened and to remove all of her clothing because they have to use the clothing as evidence. She tells her to put on this gown, which you all know is paper thin and exposing. And at this point, Penny is feeling like she made a bad decision going in. She's feeling vulnerable. She's feeling embarrassed and humiliated, and really does not want to be there. All of these insights that came from this journey map came from the interviews and observations the students did with their stakeholders in that empathy phase. Part of innovation, I'm going to talk briefly about this later, is storytelling, being able to put together a compelling story to understand what is really going on for your stakeholders. And a journey map can really help you do that if you do it in sort of an illustrated storytelling way. So after they do their journey map, they have all of their insights, they really are understanding the problem. And the students then use the problem statement activity to put together their narrow, focused problem from the point of view of the sexual assault survivors. And so I don't know how well you all can see this, but this is pretty templated. It says, I am, user description, I am trying to, goal or outcome, but, problem or barrier, because, root cause, which makes me feel emotion. And so the students came up with the problem statement, I am a woman who was recently sexually assaulted. I'm trying to complete a rape exam so that I may receive necessary medical care and preserve evidence, but the exam requires me to expose myself and be handled in extremely violating ways, reminding me of the actual assault, which makes me feel incredibly violated and uncomfortable. It's a pretty powerful problem statement that really pinpoints in on a problem that the students can now address. And so that leads us into the ideation phase. And, for a lot of designers and students, this is the fun part. This is where you're letting your ideas run wild. I tell the students, no constraints. Don't worry about money. Don't worry about logistics. Don't worry about physics or science. Like, think as crazy and as wild as you can. Because again, this is that divergence phase. This is where we want you to think about as many ways to solve this problem, as many out of the box and creative ways as you can. And so obviously the first activity I have them do is brainstorming, thinking about what ways you can come up with to solve for the problem that you just created in that problem statement. So I have all the students, make sure they have their problem statements in front of them so that you're coming up with the right solution to the right problem. Again, designing the right thing at the right time, as the double diamond model suggests. And so you want to always make sure you have that problem statement front and center. So the students, they brainstorm individually, and then they come back together in their groups and brainstorm some more. And then they bundle their ideas together to try and come up with creative solutions to this problem. And so, you can see in different color Post-it notes, they start to move things around, bundle them together, and see what solution best meets the needs of the end user. I will say, for the human-centered design process, it really should be a co-collaborative process, meaning that as much as you can, involving your end users in the whole process. For our class, the students can't really do that, but I do have them go back to the end users at every phase and make sure what they're coming up with resonates with the stakeholders. So for example, during the define phase, I have them go back and make sure that the problem statement that they've created is a problem statement that resonates with the end user, and that the end user has some say in what that statement is all about. And so that, again, you're addressing the right problem and coming up with the right solution. Another thing that they do during the ideation phase, which I think is super important, is not only writing stuff down on Post-it notes, but getting visual, starting to draw out what their solution could look like and some of the ideas around how it might work. And so this team started drawing out a potential solution to their problem statement, which was around the sexual assault victim feeling like they were being vulnerable and embarrassed by the gown because they had to get undressed and be exposed again while they were having the rape assessment. And so what the students started to come up with was a gown that was modular. So, you know, when you're doing the rape assessment in the paper gown, you have to lift the whole gown up and it exposes your whole body. For this, they started to think about, well, if we made it modular, you know, if they needed to look at the stomach, they could just lift up half of the gown and the lower half of your body would still be covered. If you needed to look at your chest, you could just remove one part of the gown and expose just half of your chest and not your whole entire body. And so they started to think through how that might work during this visualization stage in the ideation process. They also were really thoughtful in their design about how to fasten the gown together. So during the interviews, they heard that from survivors that any sort of gown or clothing that has Velcro or zippers actually is very traumatizing. When you're opening and closing it, you hear the Velcro ripping off or the zipper being pulled down, and that can actually be really triggering because that's what happened during their sexual assault when the clothes were being taken off of them. So the students worked with our materials library to come up with these really heavy magnetic buttons that don't make a sound when you take them on and off, so that it wouldn't be traumatizing to the sexual assault survivors. These are all the things you sort of learn in that empathy phase, and those are the insights that you have to sort of keep with you throughout the whole process. Which leads us to the prototyping phase. So now that they came up with a solution, the students start to put together what we call a low fidelity prototype. Low fidelity prototypes are just mock-ups of your solution in a cheap and quick way. These are not things that you want to spend a lot of time on. These are things that you want to be able to represent your solution that stakeholders can use in the testing phase to give you feedback and then quickly iterate on. And so the students during this rapid prototyping first started out coming up with a miniature version for like a baby doll so that they could see how the buttons would work and how the modularization would work. And then they started creating examples of the gowns just out of like, you know, sheets from the bed. And during the testing phase, which is the next phase, I just want to show you, they started to come up with how that gown could work. And so if you see these green and red stickers here, these represent the buttons and how they would make the gown modular so that you could pull down just the right side of the gown or lift up the stomach part of the gown. And so during this testing phase, that's where you take your prototype that you've created and you give it to your stakeholders and let them interact with it and give you feedback. Now, it's helpful to do this in the environment where the problem is occurring with the people, again, who the problem affects. And so in this class, the students don't have the opportunity to go back to their stakeholders, so they test their prototypes in class with other students and collect a lot of feedback using what we call a feedback capture grid. You want to ask your stakeholders what they liked, what they didn't like, what questions they had about the prototype, and other ideas for it. So for example, there's another feedback activity, I like, I wish, what if. So you allow the stakeholders to have an active part in designing their solution, right? And getting feedback from them so that it addresses all of their needs and, again, addresses the problem statement. So during the testing phase, again, they put together a feedback capture grid, and then from there, you iterate on your prototype, you make updates to it, and you move on with the process again. So for the class, this is where they end with this testing phase. They share their ideas and solutions with their stakeholders and, again, get feedback as appropriate. And this was the team who created the safety gown. I always like to give them credit because they did all the hard work. This was actually a team of all nurses. I have found that a lot of our most creative solutions come from all nursing teams. It is very helpful to have others on the team, engineers and designers, but I hear a lot from nurses that I'm not creative, I can't draw, I can't do this, I can't do that, but I don't see that in my students. If we give nurses the resources and confidence to innovate and be creative, they come up with the most creative solutions. All right, so that's human-centered design, but human-centered design is not the end of it. So there's really a big push now towards more of an equity-centered design. I just want to spend a couple minutes on that. So equity-centered design infuses a health equity lens into the design thinking process. And so as you see here, it's really about adding a couple different phases onto the front and back end of the design thinking process. And so noticing and reflecting, noticing whose voices are being raised up, whose voices are missing, how we are including certain types of people or not including certain types of people and views in the design process. And then reflecting on that, not only at the end, but throughout each phase. And so we are starting to implement that into not only the class that I teach, but into our design thinking approach so that, we can not only teach nurses how to innovate and how to use these methodologies, but how to do so with more of a equity-centered lens so that we can create equitable and just products and solutions for all of our patients and communities. And this is an important consideration because, design often doesn't address the structural inequities, especially in healthcare. And equity doesn't always consider the design approach. And so we have an opportunity here to use an equity-centered design framework to not only design solutions to problems that nurses are seeing in their practice, but design equitable solutions that provide just care for everyone. And so this is what it looks like in more of a human-centered design approach, practicing self-awareness, noticing biases and power, building relationships. Yes, human-centered design is about co-creation, and we should be including our stakeholders throughout the whole process, but it's more than just inclusion. It's really understanding structure and power dynamics and whose voices, again, get lifted up and whose don't, and even more so, who's at the table and who's not. So just another thing to keep in mind, we are now redesigning our Design Thinking for Health platform, again, thanks to another grant from the Reed and Alex Hillman Foundation, with more of an equity-centered design lens. So hopefully by the end of this year, we're going to be adding 2 new modules around notice and reflect, and then infusing equity-centered design throughout the entire platform. So stay tuned for that. And at Penn Nursing, we really are trying to, be more aware of health equity and how we are working with communities. And so we just launched last year a new social entrepreneurship lab called ADOS, which is a LGBTQ health initiative, as well as our Penn Community Collaboratory for Co-Creation, which is a partnership between Penn Engineering and Penn Nursing, where we are partnering with community members and using this equity sort of centered framework, having them show us and tell us what their problem is so that we can partner them with nurses and engineers to help co-create solutions to those problems they've identified. So this is where we're moving as a school, and what I hope we're moving as a discipline. And part of that, I'm just highlighting here, we are launching our new Summer Innovation Institute, which has a focus on collaborative design and co-creation for health equity. And this is the first time we're doing this Summer Innovation Institute, and it's open to students, faculty, and community members around Penn, and hoping that if successful, it'll be open to anyone next year. All right, so in the last, I think I have 10 more minutes, I just want to talk quickly about some of the other ways that we're infusing human-centered design and innovation in an active learning way to our faculty and students. Because it's not just about curricular classroom learning, but again, how we can get our faculty and students to actually be out there doing these things. And so we have our Penn Nursing Innovation Accelerator program, which has been running since 2020. That is a 3-round process set up specifically as an educational opportunity so that our faculty, staff, and students can learn the innovation and entrepreneurship process. So through this accelerator, they can win up to $10,000, as well as a structured 10-month program of mentorship and education based on whatever topic and needs that the teams in the accelerator are working on. So they go through an online application, an in-person interview where they have to describe their business model canvas and show us a low-fidelity prototype, and then a final pitch and pitch deck. And then whoever wins the pitch goes through the accelerator. And in that accelerator, they learn about human-centered design, they learn about patents and trademarks and all the different entrepreneurial skills it takes to take an innovative idea and scale it up. So it's not just about learning human-centered design and design thinking and coming up with a great idea, but learning about how to take it to the next level. And so that's one of the things that we're teaching our folks, our nurses, how to do through our Innovation Accelerator program. And I just want to talk about, I think it's really important to know that if you expose nurses to innovation, they will innovate. And so this is a group of students I had in my innovation and health course a few years ago. They were looking at the problem of elopement in kids with autism. And in class, they came up with the idea for the Stay Safe bracelet. They created a prototype, they created a pitch, and then they applied for our Innovation Accelerator program and actually won and went through the program and created a startup and had started working on actually creating this Stay Safe bracelet as a product that they could potentially commercialize. We have other students and faculty really who participate in the nurse hackathons. So I mentioned that I'm a founding member and was on the board of SUNCL, which is the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders. Every year we put on a nurse hackathon, and we've had multiple students from Penn Nursing who've taken my class, were exposed to innovation, who participated in the hackathon, and every year we have students who win these hackathons. And so I just want to highlight Anthony Scarpone Lambert, who was on this first place team, went on to take that idea and create a very successful company called Lumify Care, which created night lights for nurses to use at the bedside in the hospital setting, so that they don't have to turn on overhead lights. And there's different like blue, green, and red light settings. Anthony was actually the first nurse with this idea to win the Penn President's Innovation Prize, which the university gives out every year to students to help them work on their entrepreneurial innovation idea. And so they get I forget how much money. They get a lot of money to take a year or two off after they graduate to work on this idea. And Anthony was the first nurse to ever win that award from the idea he came up with at the hackathon. Just if anybody's interested, we are going to have another hackathon coming up September 22nd to 24th. So mark your calendars, more to come in the next couple of months. All right, and I'm going to just close with storytelling. I really feel that storytelling is a really important, not only skill for nurses to have, but way to communicate potentially complex information with patients, with communities, with whomever. You need to be able to coherently tell a good story, like I said, that pulls people's heartstrings and really wants them to, I don't know, give you money or listen to you or just understand what you're going through. It's a big part of innovation and pitching. And so at Penn Nursing, we've also put together story slams, which are theater type arts events where nurses get up and share their true real life stories based on a topic. These are not storytellers by trade. These are nurses, students, clinicians, faculty members, researchers, alumni who work with our storytelling colleagues at First Person Arts, which is a storytelling organization in Philadelphia, to craft and curate their stories and then share them at live events, either live events or virtually, depending on when it is and how rampant COVID is. That we've had multiple story slams over the past few years based on topics of innovation, creativity, stepping up, and others. It's a really great way for people outside of nursing to understand what nurses do and right now what they're going through. So I just wanted to share that. If anybody's interested in watching some of these story slams, you can see them on our website. They will make you laugh, they will make you cry, and more importantly, they will inspire you about the profession of nursing. And finally, we have a podcast called Amplify Nursing, where we highlight nurses who are leading the way in science, policy, practice, and innovation. We are in season 7 right now. We are releasing a new episode this afternoon, right after I get off of this and I'm able to post it. So you can check us out on iTunes, Spotify, Google Play, Stitcher, iHeartRadio, or wherever you do your podcast listening. And we talk to nurses from a whole range of places to just get their perspective. And again, storytelling, understanding what nurses do in all areas of healthcare. So check out the podcast again on those places or on our website. And finally, if you want to learn more about how we at Penn Nursing have put together our innovation infrastructure, I think it was last year or the beginning of this year, we published a paper about creating an innovation infrastructure in academic nursing, which lays out all of the steps that we did to get to where we are today, and how we've integrated innovation at multiple levels throughout the institution, not just in one area. So you can check out that paper if you're interested. And with that, I will happily take questions, but encourage you all to go innovate.
Thank you so much, Marion. That was so powerful and inspiring, to say the very least. And I love what you said. I took like 3 pages of notes. So I love what you said. If you don't understand the problem accurately, accurately, you really can't create the right solutions. So, folks, if you want to ask a question, please unmute yourself, or you can go ahead and type them in the chat.
Hi, good morning. This is Sandra Micala. I'm the Vice Chair for Quality in OBGYN. So this is really it was great. It was inspiring. I do have a question about the ability to evaluate the return on that investment. How have you what kind of outcomes have you looked for? Do they need to be profitable, or simply earn you a better score on a patient experience survey? How is it that your team has assessed whether the efforts were worth it?
So that is a great question. I am on the academic education side, so I am teaching our students about these processes. I am not on the healthcare side where they are potentially implementing them. So I can't specifically address that except to say it really will depend. It will depend on the solution that you're creating, the problem that you're solving for, and what your institution is ultimately looking to get out of it. It might be that you're looking for a return on investment because of a problem that needs that outcome, but it might be that you're trying to specifically address the the satisfaction of a patient procedure, and so that's going to be your outcome. Those are things that it will really depend on the problem that you're trying to solve for. I have a colleague, Hiem Nadel, who is at Mass General, and we joke that we do the same things, just she's on the clinical side and I'm on the education side. And so she could potentially answer that question a lot better than me. So I can always connect you with her because she's looking at those outcomes now in a variety of different ways.
Mm-hmm. Thanks. But just a follow-up to the question, this is something special being offered to learners, and I'm curious as to whether it further enhances their interest in their own field. I wonder, are they performing better? Just even at that level, is this driving their interest, is the retention rate higher, through the program of nursing?
So anecdotally, I hear all the time, yes. So I talk to nurses from all over the world constantly who are now using human-centered design, focusing on innovation, and they are feeling more empowered, more excited to be doing the work that they're doing. So I'm in the PhD program. I'm currently writing up my dissertation, and part of my results were surveying nurses who were engaging in innovative behaviors in their healthcare setting. And don't tell my advisors, but what we're seeing is the people who are innovating are more satisfied and more willing to innovate. There's a variety of positive associations that I can't really go into now, but yes, we're seeing that, yes, this is a positive association with innovation and exposure to human-centered design and design thinking activities, workshops, education, etc.
Thanks.
But more to come, hopefully published in the next 6 to 8 months.
We did have a question that did pop up in the chat, and it says, how do you free up staff nurses to be able to spend time on innovation projects?
So again, I apologize. I'm not on the healthcare side, so I can't really address that. But what I will say is, I think it has to be a priority. Again, the research that I did and the results that I've seen, there is a positive association with giving nurses time to work on these innovative projects, to be exposed to human-centered design and design thinking activities, and encouraging them to be creative, to be innovative, and to lead in those areas in their practice. And so it's a little early. Like, I would love to be able to do a longitudinal study to examine this in the healthcare setting so that I can have concrete answers to these questions. But the data are starting to show that these are important variables and important considerations to nurses in these healthcare settings, that they want to be doing these things and that they are positively associated in those areas.
Another question. Actually, before I ask the question that just popped up, someone did ask if we will get the PowerPoint to rewatch later. So just throwing that out there.
And we're going to upload this to either HealthStream or our patient experience SharePoint. But I think to piggyback off that inquiry that Jay had made, Marion, what suggestion do you have for how an employee or nurse could pitch their solution to their leader?
Well, so, I mean, I think a couple of things. This is where storytelling comes into play.
Right.
So I would have a story in mind to share. What we say when you pitch, start off with, the problem, but in a story, put together like a story, talk about what the problem is, what your solution is, and then wrap it up with that story showing how your solution or your idea is going to positively affect the outcome. And so I wouldn't just go in and say, I have this idea and I want to do it. Like, you want to make sure that you put it together in a narrative form and that you have the data to back it up. So what's the background? How, what percentage of it is a problem at your institution? Where's the gap? Again, thinking through the design thinking phase, like, what's the problem you're trying to solve for? And then how's your solution going to address it? It takes sort of planning and working through this whole process to be able to put together in a way that potentially administrators will want to hear and it'll resonate with them.
Fantastic. And here at Maimonides, we are passionate about becoming more patient and family centered, and it's so important to incorporate the patient's feedback into all of our processes. And I think that's what's so powerful about this framework, because the end user is a part of every step. And I think that's incredible. Even with the problem statement, that's the first time I've seen, at the end of the problem statement, it says, which makes me feel. And I think that's so important to amplify the empathy.
Yeah, having your, patients involved from the very beginning is so super critical. And really, I mean, that's where, if you're going to pitch this to your executive leadership or manager, like, having the patient front and center in this process is really important.
Absolutely. Any other further questions?
Something else pops up in the chat. It says, have you considered piloting a program for the nurses to partner with staff nurses for innovations?
Yes. So we have done, I didn't have enough time to get into everything we've done, but yes. So last semester we had nursing students partner with, so undergrad nursing students who went through our innovation in health class, partner with design grad students who had gone through a design curriculum, partner with clinicians at one of our Penn Medicine hospitals on a real human-centered design project where they worked on a problem in the emergency department for 4 months. They did hundreds of hours of interviews and observations. It was a real human-centered design project where they worked with the clinicians. They did co-collaborative sessions with the clinicians in the ED. They observed the ED, interviewed, and then created prototypes that are now being tested in the ED currently. And so, yes, we constantly are thinking about ways on how we can partner our students with clinicians in the hospital setting to be able to use these skills that they're learning in the classroom. Again, I'm a big component. It's not just traditional classroom learning, but active learning by doing, extracurriculars.
This may be sort of a follow-up to the same question. It is from the same person about the pilot program, considering a pilot program for the students to partner with staff nurses at different institutions. So I think you spoke there about, I think at the current one.
Mm-hmm. Yeah, I'm always open to ideas. If there were clinicians at other institutions that were looking to partner with students to do a design project, absolutely. We have a course at Penn Nursing, which is technically a research residency course, but we've been using it for like this design project as an innovation residency course too. So students, we could potentially partner students with others that aren't at Penn Medicine. We've done that like for years for the research side, and I'd love to do that more for the innovation side. I'm an innovator. I think outside the box, so happy to collaborate with anyone.
Thank you. I like that people keep popping into the chat. This is great. Someone asked if there's some reference materials, articles, or books that could be recommended.
Yes. So I would say if you go on to the Design Thinking for Health platform, and I'm going to type it in the chat. Under each module, first there's an overview. So under the overview, but then under each module, there is a variety of read, watch, and listen resources that you can use to learn about human-centered design and design thinking. And then we also have a resource page that lists other books and websites and activities that you can read, watch, or listen also. So there's no lack of resources. And I would just check out the Design Thinking for Health platform because they're mostly all listed there. And like I said, in the next, hopefully, I don't know, by the end of this year, that's going to also include health equity and equity-centered design resources as well.
How do you get people out of the mindset of that's just the way things are and move to how can we improve on this?
Yeah, great question. I mean, I think that using a process like design thinking, it forces you to do that. And so, if you can get people to take a chance, work through the process, and really, really work through the process, it will automatically start to change their mindset because you will see how what you've done in the past may not be the best for what you're trying to solve for in the future. And so it's really just, getting people to, yeah, I mean, I think if I had a good solution to this, I'd solve the world's problems. But if you can use the humans, really get people to buy into trying this process and giving it a chance, it does change mindsets. I've seen it. I've held so many workshops where people were, for lack of a better word, voluntold to come to this workshop and sort of sit through it, and begrudgingly in the beginning they didn't understand why they were there or why they had to do this, and by the end they were singing its praises and really understanding the power of human-centered design and design thinking. And it's not like human-centered design and design thinking is this like big magical thing. It's that it really allows you to change your mindset, to be creative, to have fun, to collaborate, and to think about healthcare and healthcare topics in a different way than what you're usually able to do in healthcare, to take risks in a safe environment. Yeah, I mean, I think it's just, again, this learning by doing, and if you can give yourself an opportunity to do it, it will change behavior.
Well, that is the end of our session. I just want to remind folks, please, there is a link in the chat box. If you could just copy that link and paste it into your browser to provide feedback on today's session. Marion, on behalf of Maimonides, we are so very appreciative of your time and this incredible presentation. Thank you so much.
Sure. Thank you for having me. I put my email in the chat. If anybody has any questions, needs any help or advice, I am always more than willing, so please reach out.
Thank you so much.
All right. Thank you all.
All right. Take care.
Bye.
Bye.